Welcome to this special session on ensuring cardiovascular wellness by tackling risk factors, part of the ongoing USV series here on economictimes.com, where we are prioritizing diabetes and heart health. I'm Miloni Bhatt, and today we are joined by two esteemed doctors. One is Dr. Sameer Dani. He's the Director of Cardiology Services at Apollo CVHF Heart Institute, Ahmedabad, and Apollo Hospitals, Gandhinagar. Doctor, welcome to economictimes.com.
Thank you so much.
I'm also pleased to welcome our second panelist, Dr. Sreenivas Kumar. He is the Director of Cardiology and Clinical Research, Apollo Hospitals at Hyderabad. It's good to have you with us here on the panel, Doctor.
Good afternoon.
So we'll be delving into the critical connections between cardiovascular disease and their associated risk factors, aiming to pave the way for effective prevention strategies. So, Dr. Dani, my first question is to you. The World Heart Federation report indicated a significant increase in global CVD fatalities, reaching 20.5 million in 2021. The InterHeart study revealed that South Asians experience first myocardial infarction at a mean of 53 years. In this background, doctor, considering this rising trend of heart attacks among younger individuals because of lifestyle, perhaps, how often would you say should young individuals undergo cardiovascular screening?
Well, I think, previously we used to say that every individual should undergo a health checkup after age 40. Then it became 30. And nowadays we say that it should be age 20, that the first screening should take place. Why so? Because we know that it is your exposure to the risk factors like high blood pressure, diabetes, cholesterol, smoking. This exposure over the years, that cumulative exposures, total exposure over the years, that counts. It is not that you are smoking today, that's why you are getting heart attack. It's not that your cholesterol is 250 today, that's why you are getting heart attack. It has been observed that the cholesterol of this 200, 250, LDL of 170, whatever, that accumulates over a period of time when your body is exposed to those risk factors. And that's why these risk factors produce a heart attack or some catastrophe at the age 50, 60, 70. Right. And if you want to avoid that, you have to begin at a very young age.
All right, Dr. Sreenivas, to you, what does young mean, and what's the prevalence of heart attack among individuals in this particular demographic?
Yeah, India, we were already aware that in India, heart attacks happen at a young age. So to define young age, we used to consider anybody who is less than 40 years of age as young. But as Dr. Sameer mentioned, we keep decreasing this to now to less than 30 also. But standard is who has suffered heart attack at less than 40 years of age, we're considered as young heart attacks. But the data, we know that in India, heart attacks happen a decade earlier compared to West. I think when you see what are the reasons happening, as Sameer mentioned, genetically we Indians are a little more prone for disease, over which superimposition of all these risk factors which are happening at a very young age too in our country, especially young heart attacks, the smoking and probably the stress-related risk, work-related stress and all that are causing more trouble. Along with the lifestyle changes which we do, we don't exercise, we take a lot of stress and sometimes indulge in smoking and other habits too, lead to a lot of high incidence of heart attacks.
All right. Okay. Dr. Dani, we know that air pollution poses a significant health risk, and Indian cities are among the most polluted, among the most polluted air. What are the emerging concerns regarding specific environmental toxins contributing to heart ailments?
Until now, we always thought that the heart attacks happen because of cholesterol deposition and cholesterol deposition only. Cholesterol deposition, of course, is the most important factor, but there is an associated element that is called inflammation. And that plays a very big role in young age heart attacks as well as later age heart attacks. And this inflammation is caused by air pollution in anything that we consume or we are exposed to. So your skin getting exposed to a pollutant, your lungs getting exposed to air pollution, your intestines getting exposed to food pollution or water pollution, all these things lead to inflammation across the body. And this inflammation in vascular space, vascular endothelium, that is the layer which lines your blood vessels. Once the inflammation takes place, that is how you see rapid accumulation of all these heart diseases and catastrophe. Inflammation
Alright.
is a very important point, and
Factor.
that happens with this pollution.
All right. We were talking about all of these factors, right? You talked about how you're exposed to, say, pollution. You could be exposed to pollutions of different kinds. But Dr. Sreenivas, I want to talk to you about, this ready-to-eat foods, right? Because of the way our lives are right now, and especially for a lot of people in the cities, you just want to grab something which is, you can just make it really quickly. How does this nutritional composition of ready-to-eat foods impact heart health? And also, could you talk to us then about another problem that, a lot of people in urban cities face is also a lack of sleep?
Yeah, these two are important risk factors which are found to be. As is saying goes, if you eat healthy, a lot of diseases could be avoided. It applies significantly to the heart diseases. The traditional Indian diets, which are very high in vegetarian fiber, are always good. But now we simulate West, a lot of software professionals, other people who don't have time to cook, women empowerment, like things happening. They don't want to cook at home, want to get the junk foods, order everything at Zomatos and all that stuff. Is anything stored food is not good actually. Anything organic, anything freshly prepared one will be good. And then probably more vegetarian diet is good, and non-vegetarian generally are prone to be a little more. And then as Samir mentioned, pollution happening through form of putting pesticides over food. Again, that's what we mean as organic food stuff, which may be good. And people are stretching it too much also. But what I would like to mention and stress is eat healthy food, which is cooked fresh food is what is good, not stored food. Coming to the oils, actually, the oil, especially what is found in the studies, is reheating of oils is bad. You eat junk foods across the road, streets, and all that. They reheat oils that's supposed to be highly carcinogenic and also causing diseases. So that's again not a good habit. Anything again healthy, people say olive oil is healthy, but if you eat tons and tons of it, again is bad. So as the Sanskrit saying goes, ati sarvatra varjit, anything too much is bad. Anything in moderation is fine, especially if you can eat fresh and take more of fresh fruits and vegetables, and that will go a long way in prevention of heart diseases and maintaining your overall. These are supposed to also have some antioxidant properties, which are supposed to be also vasodilatory effects and having a healthy lifestyle. Other important thing which you mentioned is about sleep. Sleep, I feel, is very important. And during sleep, everybody actually minimum of 5 hours to 7 hours of sleep a day is very important depending upon your age. Because during sleep, the cells and the stress and strain of every cell in the body gets to go through the reparative process and recoups itself. That's why you might have seen, suppose somebody has not slept well, then you become very irritable, and probably 2-3 days of continuous lack of sleep will produce a lot of complaints like giddiness and other problems. So sleeping well is important, but unfortunately, because of stress and workloads, things like that, and people are not able to sleep well.
Long back, I have made an adage, and that I think probably is very true of stressful situations. Stress doesn't come from the situation. Most of the people think that stress comes from X, Y, or Z situation, and they try to avoid that situation, which produces more stress. So the stress comes from your attitude to that situation. It doesn't come from the situation. So a classic way of measuring stress is asking someone how much stressed you are feeling. Rate your stress. Person who rates his stress as high is suffering from high stress. So stress is something that you feel, something that you react to. And it is not the situation always, it is your attitude, your reaction to that situation. So you can always control your stress by reacting in a different way to stressful situations. That is number one. Number two, many people tell me that they are not able to do meditation, they are not able to do certain peaceful activities because their mind wanders, and then the stress doesn't go away. My advice and our advice to these people is that physical exercise is not is very poorly recognized to be a stress buster. Physical exercise, in fact, is a great stress buster. So if you can't do meditation, if you don't have hobbies, if you don't have such habits, if you don't have relations, of course, hobbies, habits, and relations are very important to bust the stress.
Hobbies,
But
habits, and relations. Well said, yes.
yes, hobbies, habits, and relations. And the fourth thing is physical exercise. Healthy mind gives you healthy body, and the reverse is also true. Healthy body gives you healthy mind. So that is something to be experienced.
All right, all right. No, doctor, all good points. Sometimes I just feel that for people in urban settings and in high stress jobs, some of this is difficult, or I don't know, maybe there's a reluctance to do, but we hope that a lot of people who are listening are able to take away, the importance of the message and try and imbibe that in their lives.
What Samir is mentioning is our happiness, our mood should be under our control. Don't give the key to your boss or to your wife or to somebody else. So if you can maintain that, it is good. And the reactions to the
Sometimes
situation
boss
around.
holds the key, doctor. Boss only holds the key. Forget husband, forget wife,
But the reactions to it comes from within. So that's an important concept. If you can do it, keep your
No,
feelings, your mood, your happiness under your control.
yeah.
And that helps a long way to prevent problems.
No, I completely agree with what Dr. Dani said. It is how you react to a situation, because the situation itself is not causing the stress. It is your reaction to it. So but moving on, Dr. Dani, to you, data from the ongoing premature heart attack study indicates that acute and chronic stressors, which we've been talking about, which contribute to the incidence of cardiovascular disease and some of the other risk factors, some of which we've spoken of. One is air pollution. But there's, of course, for women, polycystic ovary disease. There's also prediabetes, fatty liver, hormonal imbalances, and so many others. Is there a specific demographic, if you had to look at it from the India context, which is at a higher risk of sudden cardiac death?
Yeah, I think one of the biggest risk factor for sudden cardiac death is, if you look at it, put it broadly, it is the family history.
Okay.
So family history is one of the biggest risk factors for sudden death at young age. Once you grow a little older, then these other risk factors come into play, channelopathies and cardiac arrhythmias, and then certain other diseases, and of course smoking and alcohol are very prominent. Drug abuse is one of the most important factor that we don't realize nowadays, and so many young lives are lost because of drug abuse. And by substance abuse, I don't mean alcohol alone or tobacco alone. There are many other drugs being sold, and which our young generation is kind of getting trapped into, and that is a very important factor in today's world. Apart from that, of course, the other risk factors which are very well known, they are of course there, like diabetes and uh, hypertension and cholesterol and those things. But in younger age, sudden death is very attributable to the factors which I mentioned.
Doctor, tell me something, for people who have family history, of young, sudden cardiac related deaths, what should those people be doing so that, they avoid a similar fate?
So those families where sudden cardiac death or sudden death at young age have happened, those families should undergo screening, health checks at an earlier age. This is when I say that age 20, we should start our health checks. Our health checks in certain selected families could start even earlier. And many schools have started adopting this kind of school health checkup programs And that itself is yielding lot of uh, insights into how the children contract certain diseases, even certain genetic diseases or congenital heart diseases are coming to the fore, which were not,
Right.
diagnosed earlier.
All right, doctor. Dr. Sreenivas, current lifestyle is work hard, play hard. And, we've heard of this incidents at gyms, right? Cardiac arrest during workouts, which have raised so much, which have raised concerns. Uh, Dr. Srinivas, could you discuss the risks of intense gym routines for young individuals without a sort of a professional guidance? And additionally, are there specific do's and don'ts to safeguard heart health, apart from,
Yeah, this,
everything that we've talked of?
yeah, this is very important for all the viewers to understand how much sort of exercise. Samir said physical exercise, good stress buster. It doesn't mean that you will burst yourself. And people try to become overnight Salman Khan, Hrithik Roshans by doing, and they don't have time. They immediately go to work, and somebody is calling, waiting. You want to finish everything faster. In half an hour's time, you want to do fat exercises and then go. That is where it creates trouble. You have to understand human body, heart. Also, you have to be kind to it because it's our own body, our own heart. So, what is recommended actually is do a gradual warm up and then go to a peak and then gradually calm down yourself so as to avoid getting into trouble. But people don't follow it because they say they don't have time, or if they're otherwise not busy, also they make themselves worst and then do suddenly that will create trouble. So warm up and warming down is important. And what is also recommended is the strenuous weightlifting exercises are no good. Basically, exercise like treadmill, walking, cycling, gymming, jogging are good enough. Weightlifting is just little of smaller weights for muscle building up is okay, but you don't want to become like a big bodybuilders by lifting too much heavy weights at the cost of you suffering problems. So actually, body will caution you that when you strenuously doing that, the small plaques which in the coronary arteries, which could be there as 10%, 20%, could suddenly rupture, and lot of blood clotting cells could go there, and that's how the sudden deaths could happen. Apart from this, probably people who have pre-existing some mild heart diseases like pumping function being less and all also suddenly get into arrhythmias and sudden cardiac deaths happen. So what I would like to caution is listen to your heart and body. It cautions you, it advises you not to stress themselves too, but people in spite of its warning and signals continue to do that, and that's where they suddenly land in trouble. So for people to have a broad understanding how much exercise they should do, it is
Yeah.
something like 220 minus your age, what is standard described as age predicted heart rate, what you need to do and get into. Even if not 100%, 85% of that is also good enough for
So
you
one
to
second,
achieve.
doctor, if you could go back, 220 minutes minus your age, is that what you're saying?
Yeah, 220 minus age is what is the recommended heart rate, what you need to achieve when you exercise. But always you need not go to that 100%. Even if you achieve 85% of that value is also good enough. Suppose you are 220 minus you are 70 years of age. If you see, then 150 heart rate is fine, but you need not go up to 150 also. 85% of 150 is also good enough. So something like 135%, 135 heart rate is also good enough. But apart unknowingly, people stress themselves, cross the heart rate limits, go up to 220 heart rate. That's where actually heart suffers more problems and sudden deaths also happen. So what I would like to caution is anything in moderation is fine here in exercise too. But what I recommended is doing at least 30 minutes of exercise. Like 5 days in a week, God is kind enough to give you 2 days of holidays. So, but that then also produces benefits. But on the other hand, people say they're doing a lot of walking, do half a kilometer walking a day, and say they're not getting benefits. That's also not right. So what is recommended is 30 minutes of exercise, daily walking, brisk walking, jogging, or if you can't have places, maybe treadmill, things like that is okay. But don't do too much of weightlifting. That's not good, especially for people who already had evidence of heart disease or pumping being less. And at least 5 days in a week should be done so as to get the benefits of exercise.
Talk to us about mental health in the workplace. How does this workplace stress impact heart health? You mentioned some bits of it, but talk to us about what are the sorts of measures that can be taken to prevent it. If you could round that up, Dr. Dani also referred to the fact that, it is your reaction to situations that can trigger your health. But if you could give us a holistic viewpoint.
Actually, if you see how much time you spend at workplace, actually it is more than what people are spending at homes now. So it is important for us to maintain a healthy lifestyle and be calm and maintain your mental peace even at workplace, because you're spending more time there, obviously. That's why these concepts of Google coming with very good office spaces, having healthy food canteens and places for exercise, all that has come. Our World Heart Federation also sometime back advocated this workplace wellness, what is called, because more people are spending time more at workplace than at home. That is why wherever you're spending more time, you need to be healthy, happy, and tension-free there. It is easy to say, sometimes difficult to achieve, but as Dr. Samir mentioned, it is better to change your reaction to that particular work which you have. Enjoy the work which you do. So you do it with passion, lot of interest, automatically it removes a lot of stress. Other thing what I would like to mention is be sincere, be positive, be truthful to your work. That removes a lot of stress.
Dr. Dani, to you, the New York Times published an article, and I think this is a little beyond perhaps from the realm of our discussion, but it's interesting nonetheless. That article highlighted how cardiologists are betting on polygenic risk scores to identify risk factors in patients, especially younger patients. So talk to us about any particular genetic tests which are accessible for evaluating, say, a person's predisposition to cardiac diseases?
So this is a very fascinating field and very interesting. Genetics, and I'll just talk about the question you asked. Polygenic risk score, or GRS, is being developed. And once we know more about these genes and certain mutations which are happening at certain allele, we will be able to predict who is more likely to experience a heart attack at early age. What is fascinating is that it seems that the certain genes are predisposing us to heart disease.
Right.
But it is not enough. It is just not that. It is not as simple as that. That you have those genes and that means you are at a higher risk of developing heart disease. But these genes play very complexly with environmental factors.
Okay.
So there are studies of twins who grew in different environments. And if their environments were same, they experienced the same heart disease at the same age. But when the environment was drastically changed, even these twins had different cardiac outcomes.
Wow.
So there are genes which, exposed to certain environmental factors, lead to early heart disease. When they are not exposed to these environmental factors, they are kind of subdued or silent. So as that famous saying goes, genetics load the gun, environment pulls the trigger. So
right.
it's a bit tacky, but it serves the purpose very well.
Okay.
One more thing which is very fascinating to me is that your behavior of healthy lifestyle, choosing healthy lifestyle, is also governed by genes. So there are genes which will make you choose healthy lifestyle. So if you have genes for heart disease, but you also have those genes which will make you choose a healthy lifestyle, you are likely to go for healthy lifestyle, and you are more likely to kind of offset those effects that those bad genes are having and which are conferring heart attacks to you. So it's a very, very interesting and very fascinating study about modulating genes. Understanding genes, I think, is going to be the most important thing for medicine next 7-8 decades.
All right.
I think, Samir, one more thing I feel is important is, we see when you have a family history, suppose father had a heart attack at 45 years of age, it generally comes and strikes the kith and children also at that age. So if you're aware of this fact, and as I said, environmental influences play a role over genetics. So if you're very aggressive in your lifestyle modification from 30 years of age itself, and check yourself cholesterol, the risk factors, and go for a healthy screen checks, as what Samir mentioned, can go to prevent these environmental influences over the genes. That's why occurrence of event and heart attacks could be significantly decreased. That's another message I would like to give, where the environmental factors keeping yourself healthy in spite of your genetic problems could still keep you under control. But at the same time, if you're negligent, it might come and strike you at the same age. There's another important message where healthy lifestyle practices could influence and change your genetic risk also. That's important. One more important thing is, as Samir mentioned briefly, right from your schooling days, if you can go become healthy, and then probably incidence of the risk factors could itself be decreased. Like you developing hypertension, you developing high cholesterol, you developing into diabetes could itself be decreased by being very following this healthy lifestyle right from schooling age. This is the concept of prevention of appearance of risk factors itself. That's what we call as primordial prevention. If this can be practiced right from your school age, actually it can go a long way in preventing the rising epidemic of heart disease in our country.
All right. No, this is very interesting and very important, especially if we have to avoid India becoming, the capital of heart disease in the world. These are now my final questions to you, Dr. Sreenivas and Dr. Dani. Dr. Sreenivas, to you first. Can medications or any medical interventions lower the risk of sudden cardiac death in individuals at high risk?
No, obviously, you can't downgrade the importance of medications too. Once somebody suffers an event, that's where all these things, okay, those secondary prevention benefits are there, the medicines come into play a big way. We have very good drugs like beta blockers, we have good drugs which can control diabetes, hypertension, and decrease the sudden heart attacks, things like that. Don't disrespect. And statins, which are cholesterol lowering medications, again go a long way in prevention. But that is all secondary prevention. What we are aiming at is not to get into trouble at all. But once you get a disease, even the procedures like what Samir and we do, taking patients in time to hospital in the cath labs and opening of the blood vessels, putting stents, again prevent the damage to happening to the heart once the event happens. Then again, people should educate themselves and come to the hospitals on time if you suffer a chest pain, heart attack. The first 1 hour, the golden hour time where you prevent the damage happening to the heart goes a long way. That's how I think one of the studies should be highlighted, where all these patients who suffered with events, when they were followed up in the long term, this is published in JACC, they're not dying with heart disease, they are dying with cancers, because these are all surviving these events. All the cardiovascular professionals should be thanked for this, because they take this medication, do the procedures appropriately, and preventing then cardiac deaths happening, and these people are surviving longer. That's why they're dying of cancers, because more people are surviving with the age group. That's a credit which you should give to drugs and some of the procedures which you do. But at the same time, mixing them with a healthy lifestyle and following all the precautions is very important. Before I close, I just wanted to take 1 minute and tell you the 5 important principles to keep yourself healthy, which I call is Panchasutra for prevention of heart disease. These are all doable, easily performable, but many of them think that they're busy, they don't have time, and they don't do it. And unfortunately, only 1% of the population is following these advices, what I'm mentioning. But if you can practice this more, your incidence of heart attacks and paralysis can go by 81%. That's what the studies show. What are they, if you ask me? We have discussed already, but before close, I want to briefly highlight. Sleep well, minimum of 5 to 7 hours a day. Then the cells get reparative process and you will heal yourself. Then second thing is eat healthy, as what we followed. Don't anything in excess is not good. Third, life is equivalent to motion, exercise. Practice yourself some sort of exercise, 30 minutes a day and probably 5 days in a week. Number 4, be happy. I would say not be stressful to remove the negative connotation, but be happy, not indulging in bad habits by helping others. Happy heart, mind, happy heart is a healthy heart. And lastly, as we discuss about the risk factors, your diabetes, blood pressure, high cholesterol, go to a doctor, take treatment. We have very good medication to control them. And if you follow all these 5 precautions, you can keep yourself healthy and decrease your incidence of risk of heart attacks and paralysis by 81%. Many people have this habit of saying what is going to happen will happen. God will take care. God is very busy otherwise also. He will not have time to take care of yourself. If you don't take care of yourself, God will also not take care of you. God will take care of only those people who take care of yourself. With this, I think I'll close and pass on to Samir to pass on his closing remarks.
So, this is my last question to you, and of course, you can add to anything that so well mentioned by Dr. Sreenivas. So, if an individual is identified as being at risk, what is the follow-up care and monitoring that are recommended?
So, as Dr. Sreenivas said, there are 4 levels of prevention. Previously, there were 3. Now we say that there are 4 levels. So, one is primordial, and is primary, third is secondary, and fourth is tertiary. So primordial is something like where you do not allow the risk factors to develop. What are the risk factors for heart disease? Like high blood pressure, diabetes, obesity, high cholesterol levels. These are the risk factors. And if you treat these risk factors, do not allow the heart disease to happen. This is called primary prevention. But if you do not allow these risk factors only to develop, rather than treating the risk factors, you treat yourself at such a level that you do not allow the risk factors to develop. That is primordial prevention. And then as you move towards primary prevention, you talk about medicine. Medicine comes in then from primary prevention onwards, where you treat the risk factors. Once you develop the heart disease, you treat it. That is called secondary prevention, because you are trying to prevent the complications. And once you develop the complications, you try to make the life a little more comfortable, quality, you try to improve the quality of life. That is called tertiary prevention.
Right.
And for all this, medicine, primary, secondary, and tertiary prevention is very important. And there are certain devices which can prevent sudden cardiac death when implanted in right people. That is also very important. That is called AICD or resynchronization therapy. These are the devices which end the sudden cardiac death, but we will not go into detail of that. The question was that how people who are at risk should be followed up. So people who are at risk should be identified from very young age, preferably. They should be followed up with periodic checkups, evaluations, and prevention of risk factors. They should be educated about the risk factors, how to prevent them. If they develop risk factors, newer risk factors, they are to be treated. If they develop the disease, they are to be treated with medicine. And their follow-up should be more rigorous than the other.
All right. I think, the overwhelming message here today is that prevention is better than cure. Manage your health and your emotions, maintain your relationships, and maintain your healthy habits. Dr. Dani and Dr. Sreenivas, thank you so very much for all the information that you've provided. We've covered quite a wide landscape. Thank you very much for all your insights, and which I'm sure will benefit everyone who's watching. Now, to all our viewers, you can catch all the episodes of our previous interviews with top medical experts on heart health and diabetes on our website, economictimes.com. I'm Aloni Bhatt. Thank you very much for watching.
Thank you.
Thank you, Milani. You've been great. Thank you.